This is a special report from News 3 WSIL.
Hello again, I'm Julie Williams. Tonight, we continue our COVID conversations. This week, we've been looking at COVID-19's impacts here in our region and what it means for you, our viewers. And for more on that, I turn it over to my co-anchor, Mark Kiesling.
Thank you, Julie. We're joined tonight by Paula Clark, COVID Operations Chief at the Jackson County Health Department. And Paula, thank you for being with us tonight. We are seeing a spike in COVID cases in Jackson County. Let's just go over the numbers for the viewers real quick. Last week, the health department reported 367 cases in Jackson County, an average of 52 per day that week. The previous one-week high was 302 in November of last year. And looking back at the month of June, for the entire month of June, there was only about 40 cases. So why the big spike in August?
Well, first I want to say thanks a lot for having me. I really appreciate it, and I've really enjoyed these segments. Dr. Ripita is a real hard act to follow, but I've really enjoyed that. You know, like you said, in June we only had 42 cases. We were, you know, kind of getting our breath, and then now since just the beginning of August, we've had over 750 cases, and you know, we're on mark for having a record month, which is not a record that we want to break at all.
Right.
You know, so our highest month was back in November of 2020, and with about 1,000 cases. So we're on mark for beating that, and that's not one that we really want to beat at all. You know, I think just a lot of activities. We're coming off the summer, a lot of vacations, July 4th, school getting back in session, and just a lot of travel. And activities that were safe 2 months ago are no longer safe. You know, we were all feeling pretty good a couple months ago with vaccination and thinking we were moving toward getting back to a little bit of some normalcy, and then the Delta variant hit and just kind of took everybody by surprise. And so we really need to think about the activities that we were doing when we kind of let our guard down are no longer safe.
We're also seeing a large number of teens and younger come down with COVID-19 in Jackson County.
So since August 1st, 29% of our cases are in teens, and that is way different than the original variant. And again, that's just Delta, you know, rearing its ugly head, that it is impacting children more. We're not necessarily, like Dr. Ripita said last night, we're not necessarily seeing those hospitalizations, but we are seeing children getting sick. And then, you know, children, as he also said, are great, you know, spreaders because we're all in their faces. So as much as we can, you know, have the parents be vaccinated, and then they're providing a shield to their children and then to the rest of the community.
What is some of your advice for parents with children on what they should do to protect their children at home?
Well, I think the first thing is to be a good role model, and you know, to be vaccinated and to social distance and mask, and you know, choose activities that are low risk, choose activities that are outside, that are not a large group of people. And just really everybody doing their part. That's really what it takes, everybody doing their part to try to reduce the cases.
Now, teens are capable of making choices and taking care of themselves. What do you tell that age group when it comes to COVID-19?
That age group, I say, please vaccinate. So if a teen is eligible, we want them to get vaccinated. You know, CDC, we're hoping that 5 to 11-year-olds is coming around the corner to be vaccinated. So we urge parents, you know, and those teens, have that conversation to be vaccinated. And as I said, scale back some activities, mask, social distance. You know, it's really easy to say that in hindsight. Oh yeah, I went to that family reunion, or I went on this trip or whatever, and think about that beforehand and try to just, you know, like I said, scale back, mask, social distance, all of those things really help.
Any idea of when we may see that vaccine for 5 to 11-year-olds?
It's in the works. You know, we are really crossing our fingers for fall, maybe, you know, late fall, but we are really hoping that that's just around the corner and we can get more of these school-age children vaccinated.
Okay. SIU students are coming back. Any concerns with more people in the community, more activities, more possible chances of COVID spreading between large groups, whether it be, you know, college students getting together for some kind of activity, sporting events, those sort of things?
Sure. You know, you can always tell in Carbondale about mid-August, the town's a little bit busier, there's more traffic, you know, from the students and in activities for students. So that does concern us. You know, that could be part of our spike in the last few weeks also, that students are back on campus. You know, SIU has done a great job, SIH, as a partner with them. They are asking all the students to be vaccinated, and if they're not, then they're providing weekly testing for those students. So obviously, weekly testing of SIU students who are not vaccinated is also making the rates go up. And we're hoping that they choose to be vaccinated too.
Are there any special efforts going on right now to get students vaccinated?
Well, you know, over the summer we held vaccination clinics at each of the high schools, and that brought in a lot of families and a lot of high school students. And then the vaccine's also available on campus every day and at Jackson County Health Department every day. So there are, you know, public service messages, and you know, for every person that we have to isolate who's positive, or that student who is impacted because they were a close contact, that gives them a little second thought too in possibly being vaccinated so that they're not in that position.
So can you explain to our viewers why the Delta variant is such a game changer in COVID-19?
Well, the Delta variant is twice as transmittable as the original virus. It's really impacting younger populations. Where, you know, that we didn't see before. We had a few children here and there, you know, early on contracting the coronavirus, but the Delta variant is just really impacting kids, and it's just a lot more easier to get. You know, when we're tracing cases each day, you know, if I compare that to 18 months ago, our first case in Jackson County was March 18th. I remember it like it was yesterday, although I'm way more exhausted than yesterday. You know, it seemed like certain activities you really could pinpoint to somebody getting the virus. Now it's like the slightest little thing. I mean, you know, before we could say it was a huge gathering. Now it's like you just went out to eat with somebody. And, you know, eating is a very infectious activity. You know, you're sitting there and talking and eating, and it's very infectious. And so the slightest little thing like that we're seeing. So it's just a much different strain, and, you know, one that we need to curb our activities and pay attention to. Because
it is so much more easily transmissible, should people be curtailing activities?
Oh, absolutely. Yeah, we are asking people to, you know, just again, rather than hindsight, stop and think, you know, should I really be going to this activity? Is the majority of the group I'm going with vaccinated? You know, if they're not, mask up, keep your distance. So yeah, we really want people to think about their activities and just trying to really do their part and help us out and help the community out to try to get this under control.
And what about those who are vaccinated? Should they be doing that as well?
Yes, you know, as far as our cases, only 1% of our recent cases are breakthrough cases of vaccinated people, so it's very low. So, you know, the vaccine is really doing its job. You know, if those that have had a breakthrough case are mild cases, you know, they are not hospitalized, as Dr. Rippeta also mentioned last night. But we do, you know, vaccinated people can still contract the Delta variant, and so we are asking them to also mask up. And again, you know, I've never not worn my mask. I mean, from the very beginning, whether I'm at Kroger, wherever I am, I'm wearing my mask, and we just ask for people to do that to try to help keep the community safer.
And we've been talking about this booster shot for people who already have the COVID vaccine, and Pfizer and Moderna vaccines are available now for the booster shot for people who are immunocompromised. Can you explain what that means to be immunocompromised?
Well, we, you know, as the CDC is defining it, and we have a great flyer on our website, which can explain it much better than me, but it is anybody that is moderately to severely immunocompromised, you know, whether they're going through cancer treatment, if they have any immunocompromising disease, if they have HIV, lupus, there's a lot of various things. And, you know, we're not asking for proof for any of that. We're letting people attest themselves that, yes, I'm somebody who should qualify for this. And then we're really hoping that, you know, the booster shot for everybody is soon to follow.
Okay. And are those shots available now at your office, the booster shot for those people who are immunocompromised?
Yes, so Pfizer and Moderna are both available at Jackson County Health Department. Walk in, you do not need an appointment, and we're open every day 8 to 4, and then on Tuesdays till 5:30 for those that need to come after work.
All right, Paula, we're going to check in with you again in just a moment, but right now we're going to turn it back over to my co-anchor, Julie Williams, for a look at cases around the states.
Yeah, thank you, Mark. We'll go ahead and take a look at those cases in the states that we cover. Illinois health officials report 3,800 new cases today, and with those 46 new deaths, there are 2,100 new cases in Missouri tonight, and their 7-day average is 2,700 cases. Now, Kentucky, they report 2,500 new cases, and with those 9 new deaths, now their 7-day positivity rate is still going up. Tonight, we've learned it's at 12.5%, and the CDC predicts even more COVID hospitalizations and deaths. They say by September 11th, their predictions are up to 664,000 deaths being reported. As of tonight, for reference here, 623,000 deaths have been reported. And we've learned SIH will require COVID-19 vaccinations for all employees as a condition of their employment. The policy affects all of the hospital's employees, even those working remotely, and students. All SIH healthcare workers need to be vaccinated by November 8th. And the White House says you'll need another round of the vaccine to be adequately protected against COVID-19. Now, that recommendation is for the Pfizer and Moderna vaccine. And we've also learned officials are preparing to offer booster doses by late next month. Tonight, there's still debate over vaccine and mask requirements. For more on that, here's Camila Bernal.
It's official. The U.S. is preparing to offer a third mRNA COVID-19 shot about 8 months after the second dose.
It is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now.
The Moderna and Pfizer booster shots will be offered starting September 20th, pending FDA and CDC evaluation and authorization. Data show these vaccines are highly effective in protecting against COVID-19 hospitalization and death. But 3 recent studies found waning vaccine protection over time against symptomatic infection.
Our plan is to protect the American people and to stay ahead of this virus.
Meanwhile, COVID-19 cases and hospitalizations are increasing, and that includes children under 12 who are not yet eligible for the vaccine. Health experts recommend universal masking in schools to protect young children, but some governors have attempted to ban such requirements.
You have 2 weapons here. One is vaccines, the other is masking, and for children less than 12, that's the only weapon they have.
Despite the science, not all are willing to get the first, second, or third shot, or even ask their children to wear a mask, keeping tensions high in schools around the country.
You don't have to sit here and make people do something they don't want to do.
I'm Camila Bernal reporting.
We're joined again by Paula Clark, COVID Operations Chief at the Jackson County Health Department. And Paula, have you received any guidance yet from the CDC or IDPH on booster shots for those people who have already received the vaccine who are not immunocompromised?
Yeah, so we've just today received a little bit of notification in our office just that is in the works, that we need to start gearing up and planning for it. And you know, unfortunately, as I was telling you, I think people think that we get guidance way ahead of time. You know, we need to remember that this is a pandemic, and everything is rolling out very quickly. It's changing very quickly, and so we don't get a whole lot more notice than everybody else as far as guidance. But we do know that you know, that is the next phase, and it is gearing up, and we're gearing up to be prepared to offer that to the community.
What must people bring with them when they come to get a booster shot, or if they're still needing that first vaccine?
Well, we would like people to bring their, if they're coming for a booster, to bring their initial card. If they don't have it, we can look up what their initial dose was. But we'd ask them to bring that card. That would make it a little bit easier. And you know, we're here to serve the community of Jackson County, but we're not going to turn anybody away. If somebody wants a vaccine, whether it's their first, their second, or their booster, we want to be there to serve them. And our goal is to get as many people vaccinated as possible.
Are you able to discuss the toll that COVID-19 has taken on the Jackson County Health Department, your staff, your resources? How much of a drain has this been?
It is quite exhausting. You know, most local health departments do not have huge staffs. We all have our regular 8 to 4 jobs, you know, that we normally do, and so trying to keep some of the other programming rolling and the expectations of your local health department on a day-to-day basis, and then manage a pandemic is quite exhausting. It has really taken its toll, but you know, for as many you know, unhappy situations there are, we do know that we're there and we're helping the public. We do get a lot of thanks. We do get people that are very appreciative of helping their family, and so that does make it worth it. But you know, we are stretched really thin right now. We truly thought we were kind of on the downhill slide of this, and we're having to you know, kind of pedal back up the hill with the chain off, and it's kind of hard to do at times.
What have you seen personally in this battle against COVID-19?
Well, you know, we really get to know these families, so we are helping them, you know, at least 14 days, and then if a child gets it, and the next child, and then the spouse, we could be helping these families for many, many weeks, and so you really get to know them. You know, I've kept in contact with many, or they'll call me with various questions, and so when, you know, when they have a success, or when you know, they finally get out of quarantine and they've decided to get vaccinated, you know, I want to be there and see it. And then, you know, on the downside, I mean, we've had 79 deaths, and I can't necessarily say that in public health I thought I was going to have to experience that.
For those watching, what is your message as we continue to battle this virus moving forward?
I think my message is to really do your part, and be a role model for the rest of the community. And you know, we really want to get this under control, and we just need everybody to do their part and vaccinate.
Yeah, these are real people that are involved in this fight. It's not just numbers.
Yes.
Thank you, Paula. We appreciate you being here tonight.